Hey, good morning, good afternoon, wherever you are. This is myself, Cedric Harding, the founder of Legacy Smart Group, and then I'm going to be introducing our health director here soon. But what we wanted to do was to give you an introduction to our onboarding for health, right? So we're going to go over everything that you need to get started in this process so you can have a successful open enrollment and several other things that comes along with that. So what we'll do is we'll get started. Um, and here we go. Let me share my screen, and here it is. Okay, so all right. So here it is, Legacy Smart Group. We'll go over who Legacy Smart Group here is. And boom, here's our story. So Legacy Smart Group Financial Solutions. You can find us on social media. You can reach out to me at, you can text 224-407-4888, or you can reach out at legacysmartgroup@gmail.com. So here's our mission, but today we're going to focus on just what our vision is, too, as well. It is to help each person see financial solutions through three lenses: life, health, and wealth. And today we're going to focus on the health side, but we're still touching the life and the wealth side too, as well. All right, here's a quick overview. The purpose of this is to properly onboard the next 5 to 7 figure earner in the health insurance industry. This is the beginning steps. These beginning steps are critical to your business success. And I truly, truly believe that your attention to detail will contribute to your devotion to duty to assist the families and small businesses. So we definitely want to welcome you to what we call is the Wild Wild West, the insurance in the hills. So that's a joke. So for all of you on the back. So here's the overview. We're going to talk about contacts and our partners. We're going to talk about who our partners are: the FMO, the IMO, financial management organization, and so on. Your health IMO. So there's levels to this game. Well, where you work with us, we're your first level of trainers and support, coaches too as well, and then we have our back office and the next levels all the way up before you even touch the carriers. We'll talk about the timelines from beginning to the end, and I promise you, this is just a cycle that just repeats itself. So as you find the next 5 to 7 figure earners that could change people's lives and yours, you'll see that this is a process that we've done for just about 2 years, and it's been successful too as well. We'll talk about the certifications and trainings required, tools for success using our FMO and IMOs, types of contracts, ancillaries, who needs your help, and then we'll get to the meat and potatoes is getting started. Okay. All right. So just to kick this off, here are your LSG Legacy Smart Group and our partners. Myself, Cedric Harding, I gave you my information from the beginning. And then also we have our mighty long-term partner, friend, and trainer coach, Miss Marquita Solomon. She is the founder of Solomon Financial Solutions, and she has came on board to support Legacy Smart Group as one of our lead health producers. So she's a wealth of knowledge. Please take advantage of reaching out to her. Doing, she's going to require you to do your research too as well, but she's going to guide you and coach you to read and become very proficient and efficient at everything that you do. Here's her contact information, and then also we have our third level of support, which is Mr. Rob Raw. He is the for our back office, the TKO Health Director. But when you utilize myself, Miss Marquita Solomon, then you may find everything that you need. Well, we always have someone that's there to support us, and that's Mr. Rob Raw. All right. He will also be one of our trainers as we talk about, we get into our timelines. So, um, the next part is, who are your FMOs and IMOs, right? So the first, you know, we've met you. You decided, hey, this is a great partnership. We're going to be training you, and where are we getting it? How are we obtaining the contracts and several other things? So we're using TKO Financial Network, which is founded by Mr. Tony Martinez. He's the first line of contracting for us, and also our first level of training using myself and Miss Marquita Solomon. Now, with that being said, the second line of contracting, where also you receive your commissions to as well, as Peak Performance. There will be a tour also, usually annually around the April and May time frame. You'll see Mr. ACA Clay, that's what he's known as, Clay Peak, which is there on the right. Amazing gentleman. He's been doing this for years, just as well as Mr. Tony Martinez, that's been in the industry for just about 20 years. And then we'll go over to another partner that partners with Peak Performance too, as well, where you may receive additional carriers or commissions, but everything will run through Peak Performance, which is agility. Now, maybe now for those two, just to go back, Peak Performance is focused on ACA. They do offer Medicare, dental, vision, and all of those. I won't get too deep into that, but I wanted to say that because that is their primary focus is ACA. Now, then you have our partner Agility, that's there, and then we go into Global Premier Benefits, which was founded by Mr. Uh, Tony Holland. So Tony Holland is nationwide, very well known, and his organization is focused on Medicare. That's where we're going to get our training and several other things, but we'll get a lot of those things from your first line, myself, Marquita Solomon, Mr. Rob Raw, and our additional training and coaches. And then, of course, we do have some other resources too, internal to Legacy Smart Group. We have our partners, which we'll introduce to you when the time comes, which is a reminder that Legacy Smart Group is founded by myself, and then you also are just as equal to me as you will be running your own business. So at this time, I want to take a second. I want to introduce Miss Marquita Solomon. I want to pause this for a second, and what's going to happen? She'll introduce herself, and I'll go back to sharing the presentation, and then we'll get into it. So, Miss Marquita, if you want to give a quick synopsis of who you are, and then we'll go from there, and let me know when to share the slide.
All right. I am Marquita Solomon. I am the owner, founder of Solomon Financial Solutions, and I have been in the industry roughly 11 years. Um, so I'm really passionate about what I do and all of these aspects and things of that nature. And I decided to tackle on the health to be able to let people or teach people how to grow in that particular lane in this industry.
All right. Amazing. So I got one more thing to share, Marquita, then I'm going to pass it over to you to take it to bring it home. All right. So as we talked about timelines, and this is where Miss Marquita Solomon brings her experience, right? And this is something that we sat and put this together just about 2.5 years ago, where it has brought the success to not just our organization, but others that we partner with. So we know, and let's backtrack here, right? And this is the cycle. So we have from October to December, you have open enrollments, right, with an S. There's for Medicare, there's for ACA, there's for business, small businesses, that there's their time that they need to, hey, do group plans and make reconsiderations and things like that. So you have that window where you work extremely hard, and that's where you go in and build your that 5 to 7 figure income. But just remember, I'm gonna, as I see it at there in red at the bottom, and I'm gonna stay on track. That guess what? It's all year long. Okay. So September is a blackout. Mostly that is a blackout where contracting, you have to have everything done prior to that month because it becomes overwhelming for the carriers where they want to ensure that you have everything that you need to start be to enter into open enrollment and get started, ready and go. Now, June through August is this is the time frame where you want to complete all your required state and carrier training. So there are state-based exchanges where you have to do what the state says they want you to do this. And also the carrier may have additional information that they have for you. Hey, we have some new items, products coming out. We want you to learn about these bonuses, incentives. You want to know about those things because that will be part of your conversation during your sales process. Okay. I don't like saying sales. Then you have March through May, which we're in that season right now, or 2025. I hate saying dates, but March through May, that's the perfect time to get all your contracting done, right? Or recontracting. There's an ACA tour with Peak Performance that's going on right now around that time. There are boot camps for health nationwide, right? Whether it's at a the FMO, the IMO, the wherever it is, those boot camps are happening now during that time frame to get you prepped for open enrollment. And then also for my builders agency building. So we want to get everybody on board now so we can get everybody prepped for open enrollment. It's going to take that period of time to ensure that you're ready. You just can't, okay, I got my license and I'm ready to sell. It doesn't work like that. There is a process and there's a lot of knowledge that you have to take on because now you are independent, nothing's captive, and every location is different. I am currently in the Chicagoland area, but that may not be the same as the Tennessee, Nashville area, right? So there are so many differences, and this also gives you a time frame to learn your community. What carriers do they actually like? Oh, I don't like this company or that company. Only because I'm recording, I'm not stating carrier names. Okay. Now, on January through February, there's the second phase of open enrollment. Look, Marquita's gonna jump on me if I want to say the wrong thing, but there's special enrollments. Okay, there's some that may have missed it, or there's individuals that part where it says all year long. There are individuals that may transition from their job. They may have retired or done whatever, and now that creates a special enrollment, and that can happen any time of the year. So you want to make sure that you meet the qualifications at any given time. As soon as you have your license, you want to always be ready. So at this time, I want to pass it over to Miss Marquita Solomon, and she gonna bring us home. All right.
Hello, hello. As Cedric stated, we are on that timeline. This is the perfect time to try to get your ducks in order. And I am here to help you. We are here to help everyone get on track with everything. So, the first thing we're going to, these are just the highlights. The first thing that we're going to talk about are your certifications and the different type of trainings. First, you have to do your FFM certification, which is the Federal Facilitated Marketplace. Once you do that specific training, you will get your certification. And then when you are in the FFM, you'll be able to get your SHOP, which is the small health organization plans or it's the SHOP plans for small businesses. There, you'll also get the training for help on demand, and that is the lead system that they also um, they like send you leads for ACA time. I'm not saying that it's about 40 leads a day or 30 leads a day. The bulk of your business is going to become from you. They're just, if they're backed up or whatnot, they just have that help on demand system where they'll push leads through and whoever gets them to be able to help the client. And those are normally state based. So wherever you are, like I am in Tennessee, they're going to send me Tennessee leads. Although I may be licensed in other states, they're going to do it specifically for the your resident state. Also, you're going to have your valid health license for your resident state. I always will always encourage you to start health in your state. You may have 10 different licenses or 5 different licenses, but if you do not have the clientele or the bandwidth to be able to work multiple states, just start in your home state, and that'll be the easiest thing, and you'll understand that there are more people that you can help in your own state instead of trying to stretch yourself thin. Oh, back to the FFM training for ACA. I'm pretty sure that we will post the links later on in the slideshow, but again, this is for the federal ACA. This is the Federal Facilitated Marketplace. These are the state-based plans if you do not qualify for Medicaid. So that means you make too much money where you can't get state coverage, but then you don't make not a quite, you don't make an enormous amount to just have traditional health insurance. This is that middle ground. AHIP certification. Those are for the individuals that want to help people 65 and older. There is a cost that comes with the AHIP certification. Um, Closer to that time, we'll be able to post where you can get the AHIP certification. Some carriers do it, but we kind of want to keep everyone on the same wavelength, same page, and we will provide that link for the AHIP certification. We do have group insurance as well. There is a cost associated with it. So I don't know if you have heard us talk about the roadmap before when we partner with Peak Insurance, but there is a section in there that teaches about how to work group plans or group insurance that does have a cost associated with it. And again, we can talk about that more in depth later on. We also do long-term care. So with the long-term care, there does come um, a certification and a training along with that. So you have to do that training in order to sell the long-term care policies. Um, and then it may be a cost associated with it depending on the state you're in. Um, and then here are the tools and the links. So again, there's the FFM certification in the link. Health Sherpa. Health Sherpa is once you complete your FFM certification, you already have your licenses for your states. You'll go into Health Sherpa, create an account, and they'll let you pick every single state, every single carrier. But please don't do that. Pick the states that you are in or that you are actually working on, and then pick the carriers that you're going to work with. For me, I choose the top 3 and then an off brand or 2 for the state that I'm in. So when I say the big 3, you just understand your area that you're in so you'll know the big names that are in your particular area. Um, Here's that ACA roadmap that I was talking about. I live by the roadmap. As a team, I know for certain that we will be able to do tremendous things. Even if we work the roadmap together, at some point in time, we're going to try to work this roadmap together before open enrollment this year. But that does not negate the fact that you kind of need to work the roadmap on your own if you already have a Peak account. You'll be able to look at all the videos, the trainings, and things of that nature on your own, and you don't have to wait for the team to go ahead and do that. Number one thing, yes, create a separate email just for health. You will be astonished with the amount of emails that come through for health. So you get everything from all your contracting links. That's where all the carriers are going to start emailing you specifically for their trainings, the different products that are coming out, commission statements, things of that nature. Create an email just for health. That way, nothing gets overlooked. It's easier for you to find if you just have a health email. Um, there's a help on demand. Yes, and you do have to complete the CMS training in order to get the help on demand certification. And again, I explained before, that's where CMS funnels leads to you, and it's no cost at all. But again, like I said, the majority of your business is going to come from you, not help on demand. All your carrier sites, you have to complete the training in order to figure out which carriers that you're going to be receiving emails from, or your logins and things of that nature. I would say star, pinpoint, pin, however you do it on your computer, all of the different carriers. Make sure you write down your username, your password, your agent number or writing number. Trust me, they will need it if you ever called in. Not a lot of them are ready to pull up with a social. It's so much easier to do it with your writing number. Um, Mighty Networks, absolutely. Everyone should have their Mighty Networks account. If you do not have a Mighty Networks account, let us know. You can look it up on your phone. You can put it on your desktop. It's the same login as you had for the when you registered with TKM. Um, but there is so much information. More people are on Mighty Networks versus the website. This is literally how we stay in touch with the whole entire organization. Um, and most of the time, if you have a question, you can pretty much look it up into Mighty Networks and it's there. But we're going to highlight the commissions chart. The commissions chart is there in Mighty Networks. So it breaks down by every single state, every single carrier, and how much you'll get paid, and it lets you know your different levels. The TKO website for referrals, or the LSG team chat, which is how we communicate daily. Someone's always dropping nuggets in the chat, and we're going to continue to do that to let everyone know where when trainings are, our wins, our successes, and things of that nature. Then we have, you can use Google Meets or you can use Zoom. Right now, we're on a Zoom. But if you have that option, you can do Google Meets. It comes built into your Google account. But, there are drawbacks to using Google Meets versus Zoom. Same thing with Linktree or Calendly. Calendly, paid service, and you'll be able to integrate more with Calendly. It integrates more into a lot of different things. You need a separate number. Well, most people do or should separate your personal and your business. You can do a Google number. It's free. Well, it was free. I don't know how they're operating now. Or you can do a business phone number, which is highly looked upon and recognized when you are trying to break out into an actual business. They'll rather have a business number. Trust me, it has its perks. A working laptop. You'll be surprised that people try to do everything on a phone, or they might not, have the best service or connections or whatnot when it comes to this or business. But make sure you have a Chromebook, laptop, a large enough screen iPad that you'll be able to help your client. And then again, we're going to highlight the weekly health trainings. And those are done on Thursdays at 8 p.m. Central by the organization's health director. And then we'll have specific nights or shared nights for health training with the LSG schedule. So on the days that we actually meet together. All right. So the different contracts. So, of course, like I've already mentioned before, you're going to apply for the carriers in your state, pick your top three, your big three, and then an off brand or two, because someone will always want the off brand. It's better for you to have it and not need it than to need it and not have it, especially during the blackout period when open enrollment is already going on. Of course, you're going to get all your ACA contracts. And then if you are doing Medicare, do the Medicare contracts. Do those as early as possible because each carrier has their own specific training before they will even let you like open up to get their products. Like it's a standstill. You'll have to do all their training. Um, we have the hospital indemnity. We have several carriers for hospital indemnity. We have the dental and the vision, several plans or several carriers that we go through dental and vision on. And the business or the group plans. As mentioned before, that's that step 6 in the roadmap, and that is the cost associated with it, $99. So if you do want to learn how to sell group, that is the way to do it. And that's a lot of training, a lot of nuggets, and we'll still be here to help you. But yes, that is great. We also offer pet insurance. You'll be surprised how many people love their pets. And yes, they do cover them. But once you get to the hospital indemnity, the dental and vision, it's the cross selling that makes it just a perfect pair. It's a perfect unison. But yeah, we have all of those things. And is that it, Sid? I can't remember.
We
Oh,
got some more.
well, I mean, the ancillaries, which are the dental, vision, hearing, and things of that nature. So here, hospital indemnity, we will do those by request only. Those are not automatic. Dental, vision, and hearing, we do have several companies listed, as you can see. Um, and then, of course, we do have more, but these are just the main ones highlighted. And then, yeah. So, who needs our help? Everyone needs our help. So individuals between 18 and 64, and when it says includes households, that means, you know, your spouse, your children, and etc. Even if you are employed and your employer covers you and they will cover you, but it costs an arm and a leg to get your family covered, this is where um, you know, the ACA comes in. It's called, we put it down there, family members of employed personnel, the family glitch. So if it costs an arm and a leg to cover your family, you'll be able to get an ACA plan if you meet the criteria with the income and then get your family covered at a decent rate. Individuals above poverty. So if you make $5 more above the poverty level, they will not help you. So this is where ACA comes in. So that means you are not on the state-based plan. There is no Medicaid for you, but you will still be able to qualify for an ACA plan. And they do have a lot of $0 plans. This is for small businesses. A lot of small businesses do not offer health insurance or cannot afford to offer health insurance to their employees. So this is where you go into those businesses, the small ones, the local ones, the ones, the small chains, and you talk to them. We've already discussed, which type of businesses that you should go into. You have um, estheticians, you have service workers, child care workers, just to name a few. Nonprofits. When you think of nonprofits, you normally think of like the 501c3s or 501c4s. A church is a nonprofit. There are workers in churches that may need coverage, or the church pays for coverage and they're paying out an arm and a leg. Schools are considered nonprofits, so we can reach out and we can help these people. Career transitioners, and those are the ones that may have been recently let go from a job or in between jobs or whatever the case may be. They need coverage, and we can help them get that coverage, whether it's just for them or for them and their families. Um, Government parties, again, that's more so on a contract level, but there are still opportunities for us to be able to help. And then again, here's that family members of employed personnel, the family glitch, which I was talking about earlier, where if you are covered on your job and it still costs an arm and a leg and it's over budget, or it's just you're over the levels, where it's just deemed, unaffordable, you may be able to qualify for the family glitch for your spouse, children, and everything. So for getting started, number one, complete your FFM certification and or your state-based certification for the current year. Get you an email just for health. I would say get the email first and then start everything, because trust and believe, you will have to verify who you are, get emails and everything like that. Have your insurance license for health. Insurance license for health. You can't just say I got life. I got a license, but what license is it? If you only have a life license, you cannot sell health products. Even if you wanted to sell hospital indemnity, you would still have to get your health license. Make sure you have your E&O that is up to date. If you only have a life license and then you're going to upgrade to the life and health, you also need to switch your E&O to make sure you have the correct coverage. You need to have a bank account just for payments for your insurance. Try to keep personal and business items and monies separate. Have a voided check for that business account or the bank account used for insurance purposes. You're going to register and create an account for Peak. You're going to be able to track all your contracts from the carriers. You're going to complete whatever other training is needed. I'm pretty sure we ran down the list, and I don't think we left anything out, but if we did, I apologize. You can always come and talk to us. And register for Health Sherpa account. The Health Sherpa account also does create a link for you for marketing, and you can go in there and you can adjust it. You can change it for whatever your business is or whatever you want to market under. And then that's what you'll post, where people will be able to come in, click your link, and then they can actually enroll themselves or start the process of enrollment, and then you'll be able to take over and help them from there. Um, there you go. With Health Sherpa, turn on the carriers for the sales, not referrals. So when you are in Health Sherpa, like I told you before, you'll be able to click every single carrier, every single state, because it's actually up to you to let them know what state you're in, where you're selling, and what exactly you're selling to. And again, as a team, I believe that we can do 100 enrollments in a year just on you. You'll be surprised how easy enrollments are, and in helping people. You'll just want to keep doing it. And it's really not based on the numbers, but I'm just saying 100 is not a hard number to hit, you know.
So, with that, thanks, Marquita. Um, if you turn around and you follow the process, and And what we wanted to do was, there's so much going on. There's here, emails. Check this box, fill out this link. This presentation, I promise you, we designed this to um we don't want you to be in a situation where you have to figure it out. So here it is. We cast a net for you and we caught everything, and here's everything that you need. Now with health, everything, and someone may tell me, why can't it just be this way? It's not designed that way. It's only because some people may just say, I have a health license. I just want to do dental and vision. They don't want to do the Affordable Care Act. They don't want to do Medicare. They don't want to do this or that. So that's why all the steps are separate. So we're tossing it out there to say, this is everything that's out there. These are the things that you need and to be aware of. And if there are steps, you have to do them in this order. Or else, if you don't do it in that order, let's say for the Affordable Care Act, then you may be lost in the sauce like I was. I thought that I could just go and do quotes, but guess what? I missed a step. I did not get a contract for Blue Cross Blue Shield, and I thought it was automatic. It's not. So there's so many steps with this where you have to individually track your business, because it is really hard for anyone else to know what you have, because the information is going directly to you. So with that said, that's the end of this video. Definitely don't forget to reach out to myself, Cedric Harding, 224-407-4888. Right? I feel like that was a cool number, right? And then you also have Miss Marquita Solomon that did an amazing job getting the information and helping me put this together as my health director for Legacy Smart Group. And her and go follow Solomon Financial Solutions on social media. Check out her website. She's doing great things, and definitely, if you're in the nonprofit space, she might be the person that you want to talk to. All right. So with that, that's the end of this video. Have a great time, a great open enrollment, and I count on you having 100 enrollments this year. I'm looking at my face; it's just shiny, right? But 100 enrollments plus, right? And that's just the beginning, and much more. And it does take this much time to start. What's not in a presentation is you have to make the connections building up to open enrollment. So on day one, guess what? Hey, I need health. They're already ready because they've been waiting on that day, because you properly marketed. You got your marketing up. You've been communicating and being consistent with putting out information to capture everybody that you need for open enrollment. So have a good one.